couple chapters, wonderful things happen to your blood sugar. You stop experiencing the blood sugar swings that were making you hungry or crazy. You lose a couple pounds without trying, and you start to feel good. A month later, you realize that your blood sugar is finally low enough that, if the research cited here is right, maybe you won't have to lose your feet like Grandma did or go blind like Uncle Willie. Then, just when everything is going so well, you make the terrible mistake of confiding your enthusiasm to your doctor, who tells you not to get your hopes up because no matter what they do, everyone with diabetes always deteriorates. Congratulations, you've just run into the second toxic myth that kills and maims people with diabetes. This toxic myth is the single most dangerous idea that you are likely to encounter as you begin your struggle to live a healthy life with diabetes. It is the belief that science has proven beyond a doubt that no matter what you do, your type 2 diabetes will get worse. Your doctor almost certainly believes this, though he may give lip service to the idea that you can control your disease through diet, exercise, and drugs. What he really believes is that nothing you can do will make much difference in your long-term outcome. This is why your doctor doesn't urge you to lower your blood sugar to normal levels, but merely writes you prescriptions for drugs that, at best, do a mediocre job of controlling your blood sugar. After all, why should he urge you to struggle and deprive yourself of treats when the truth is that no matter what you do, you're doomed? There are several reasons why doctors believe this. Some will tell you that they've seen it in their practices. They'll tell you that they've treated lots of patients with type 2 diabetes and that few, if any, of their patients can achieve anything near normal blood sugars with diet, or, for that matter, with all but the most dangerous drugs. They'll add that though they have counseled their patients to lose weight, their patients don't, and even those who have good control end up with complications. If you challenge the doctor further, he's likely to tell you that it isn't just his patients. The research shows everyone with diabetes deteriorates, regardless of how good their control might be, and to back this up, he will cite the one big study that doctors always cite when the topic of good control for people with type 2 diabetes comes up, the UKPDS. Did the UKPDS prove people with good control still deteriorate? The UKPDS, United Kingdom Prospective Diabetes Study, was the largest, most exhaustive research study ever run to investigate what happens when people with type 2 diabetes improve their blood sugar control. It was an attempt to duplicate another landmark study, the DCCT, Diabetes Control and Complications Trial, which was a study of people with autoimmune type 1 diabetes, which found that people with type 1 diabetes who maintained tight blood sugar control got far fewer diabetic complications than those with higher A1Cs. Unfortunately, when it was complete, the UKPDS appeared to prove that tight control had far fewer benefits for people with type 2 diabetes. Doctors will tell you that the UKPDS proved that the A1C test results of even the patients with good control gradually worsened every year. Not only that, but the UKPDS found that good control only made a small difference in the rate of complications, and that over the course of the study, even the people with good control got lots of complications. This was best exemplified in a continuing medical education CME presentation by a distinguished English diabetes expert, Dr. Roy Taylor, a professor of medicine and metabolism at the University of Newcastle upon Tyne. It is no longer available online, but when it was, viewers could see this well-known diabetes expert point to a chart taken from UKPDS data titled Newly Diagnosed Type 2 Diabetic Subjects Showing Progression of Retinopathy and explaining, "These data are usually presented as showing